So I was an aid worker with Australian Red Cross when I went last October to Sierra Leone in West Africa, and I left at the end of March this year, and I came back to Australia in April. So the slides will just keep going around during the talk. In late 2014, I had found myself questioning the values of my workplace. It was then I realized my energies could be far better used elsewhere. The world seemed to be standing back, watching some very poor countries being belted up by the nasty disease that is Ebola. West Africa was being abandoned to a horrible fate that I found hard to think about. I noted my old employer, the Red Cross movement, had stepped up to the challenge and had become involved. I decided to be part of the solution rather than a spectator, so in October 2014, I found myself headed off to Sierra Leone. What was happening to people in West Africa was just as horrible as the scene that confronted Henry Drouin in 1859, when he witnessed over 20,000 casualties of war lying unattended on the battlefield. Rather than travel on, he organized the locals to tend to the injured and dying. The Red Cross was born. The spin-offs included the Geneva Convention, and Henry Drouin went on to become the first recipient of the Nobel Peace Prize. This Ebola outbreak was much larger than previous ones. It had already killed more people than the previous 20 outbreaks in 38 years. In the past, MSF had provided much of the international effort. This time the task was enormous. This Ebola was becoming a threat to the world, like the plague of the past, and most of the world responded to that threat and the fear it caused by putting up barriers to prevent Ebola entering their individual countries. The fire was raging and the neighbors were filling fire buckets to protect their own homes rather than all joining forces to attack the blaze at its source. We all found the thought of Ebola in our community frightening. Think how much more frightening the West Africans must have found it. They faced it with a health workforce depleted by recent war. Their health workers were dying from Ebola. This made it harder to fight the spread of the disease. Red Cross provided a boost to the depleted health workforce, teams that could build specialized field hospitals and leadership. Most importantly, our presence told the locals to have courage. They had not been abandoned. Courage is contagious, just as Ebola is. In the end, Ebola is proving no match for courage. UN Secretary-General Ban Ki-moon provided the world with a clear imperative when he said, "The best antidote to fear is an effective and urgent response." The lessons from Ebola that we carry on preparing for the next outbreak have been examined in the US by the Presidential Commission for the Study of Bioethical Issues. It has published a report reviewing the response to Ebola and presenting suggestions on how to prepare for the next outbreak better. In their press release, they pointed out, ethics and enlightened interests converge in calling for our countries to address epidemics at their source. They also pointed out, needlessly restricting the freedom of experts and caring healthcare workers is both morally wrong and counterproductive. It will do more to lose lives than to save them. I now want to share with you my personal experiences at the front line fighting Ebola in Sierra Leone. I have worked in 2 of the Red Cross Ebola treatment centers since October last year and returning to Australia in April 15. For me, the experience had a very positive side, working with aid workers from around the globe, and at the same time it was very sad. There was the positive energy of being part of the team fighting the battle against Ebola, and also the sense being in the midst of a major medical front line. There was the positive energy in the stories of why people have assembled in 2 African towns to do a difficult task for others. This was inspiring and made one proud to be human. Each time we admitted an Ebola patient, we reduced the chance of transmission to others. Each safe and dignified burial likewise reduced the spread of the disease. Each admission hopefully improved the chance of survival of the admitted patient. These were all positives. Each admission meant someone may die alone rather than surrounded by family. That is the hard part. In the first few months of this disease, the death rate in this variant of Ebola was about 80%. So many of those admitted died, and many of these died alone. Out of fear, many of our patients presented late and were very ill on admission, which gave them little chance of survival. So we often found ourselves caring for people we had almost no time to know before they died an awful, painful and lonely death. The first time I dressed in the elaborate protective outfit that we wore, I entered the ward just as a 2-week infant began to fit, and he bled to death in my arms. While I found this confronting, I then came to realize his mother sitting with us had just lost her 7th child to Ebola. It had taken her whole family. She felt she had no reason to live. I realized right then I had no right to self-pity. This was my introduction to Ebola, a disease that takes whoever it pleases, baby, child, brother, sister, mother, and father. Death was stalking West Africa in the same way it had during the plagues of Europe, and it brought the country to a halt through fear. Schools were closed, health resources were diverted from other diseases, such as maternal health and malaria. Many businesses went under. Over the weeks I was there, I saw many children, young adults, women and men die. Sometimes they would fight so hard to survive and overcome the virus, but the virus would overcome them. Others would be doing well, eating, drinking, talking, and you would think that all is okay and they are going to make it. But the virus would move in swiftly and silently and take them suddenly and alone. That was always something I found hard, that people died alone, some very frightened. I sat with one 16-year-old who arrived from Freetown the day before. His family came. His father was a local doctor who had died treating Ebola patients. Unfortunately, after he contracted the disease, he passed it on to his family, his wife, his mother, 2 sons, one being this 16-year-old who had all been confirmed cases of Ebola. This young man was very sick. I had put up IV fluids with maybe some hope that he successfully fight it. I then especially dressed in PPE to go and sit with him for about 40 minutes as he was scared. I held his hand during this time. I told him I had come from Australia and that my name was Anne. I told him to fight. He died. The next day, his brother, who was doing well, eating, drinking, talking, died. His mother and grandmother did well and survived. Yes, they are survivors. Yes, there are survivors. With each survivor, we wait for them to be symptom-free and then check their bloods to confirm they are free of the virus. Once the person is declared free, disease-free, this is what we call the happy day of discharge, which includes a discharge shower, which has been named the happy shower. They receive all new clothes, money, food, and transport home to their families with a certificate to say they are free of Ebola, which hopefully enables them to be accepted back into their communities. One of the last things they receive before leaving the center is a handshake. This handshake symbolizes so much for them, as they have been unable to have the human contact for this time, and now they are free of the virus and they can touch other people at last. Even when the patient has recovered, the virus is present in semen and breast milk. The virus is viable for up to 3 months in semen and possibly some months in breast milk. Because of this, we hand out 190 condoms on discharge, with an offer of more if this is inadequate. That's meant to be funny, that line. We don't want to be accused of supplying not enough. Counsel and education is given about the risk of sexual intercourse. For confirmed cases who are breastfeeding mums, they are advised not to breastfeed for 3 months. We give out formula and discharge. This has a huge impact, as you can see in Africa. One of the most important things Red Cross have done in this crisis is to set up a very poignant graveyard for those who have died. They have replaced the previous mass graves with individual name plots. This is very moving and memorializes those who have lost their battle with this disease. When people die, it is the most contagious stage of the disease, as the virus has multiplied within the body and can last up to 4 days on and within the corpse. Families are not able to continue the normal burial practices that they do for their loved ones. Trained burial teams have taken over the funerals of all the confirmed and suspected Ebola cases. The body is sprayed with chlorine 0.5% and placed in double body bags. A photo is taken of the face for the family. Families are invited to the burial, but do not always come because of the stigma that surrounds this disease. If the family are unable to be present, the members of Red Cross provide a suitable combined Christian and Muslim service for this person within the next 2 days, as the weather is too hot to leave it any longer. In the areas I worked, the people were very welcoming of aid workers, especially Red Cross. There has been a lot of work by the Red Cross in the education around Ebola, regarding the disease, contact tracing, surveillance, reuniting families. They are grateful to the Red Cross for their effort. While I was there, I saw more survivors. My initial experience fighting Ebola made me want to return and again to be part of the solution, and so I returned. The local staff are so grateful. They are grateful we have traveled so far, leaving the safety of our homes to help their country, their people. They are the real heroes. They work so hard, they have coped with being stigmatized. They have overcome natural fears to tackle the disease. They watch members of their community and country die. They spray their dead countrymen and bury their people and loved ones. They are heroes. They come to work every day. They want to be rid of Ebola. We are now in the recovery phase of the epidemic, and Sierra Leone was declared free as a country on the 7th of this month, November, which is great news for Sierra Leone. The image of Ebola in the West has been the PPE space outfit. PPE, this stands for Personal Protective Equipment, and the spacesuit appearance of this outfit is what the image of Ebola around the world became. PPE made treating ill Ebola patients safe. With use of PPE, the transmission of Ebola to healthcare workers dropped dramatically. Basically, Ebola is transmitted by contact with body fluids. This means if your entire body is covered, then body fluids cannot make contact with you and you cannot get Ebola. It all sounds very simple. However, it is not that simple. Taking the PPE off involves taking off contaminated layers without becoming infected by contact with any of the contaminated outer surface of the outfit. It has to be done properly. It was being done in tropical heat and humidity after 40 to 60 minutes of being cooped up in a suit that does not let your body heat out. It is always done with a companion present to make sure mistakes do not happen. PPE is uncomfortable and hot, and you can only wear it up to 60 minutes. Otherwise, you'll get too hot and can collapse. PPE includes triple gloves, so it is hard to do procedures, putting in drips, taking bloods. The gloves also make it hard to have the usual physical contact with patients. That is so much of the comforting role nurses and doctors perform. PPE has another effect. It helps you disconnect enough from the suffering around you that you can cope better with it. As public health professionals know, the hardest work of stemming an outbreak is at its end. This outbreak, like all those before it, presents the risk of resurgence until there are no transmissions from the last case. Vigilance is required. Survivors can suffer health problems up to 2 years following survival. 900 health workers, that's doctors and nurses, 900 have been directly affected by Ebola. Over 500 of whom have lost their lives to this disease. We can never forget the price paid. Red Cross teams have buried 30,000 bodies. In the district I was working, Ebola left 900 orphans. I would like to make some comments on my return to Australia to help understand the process of returning aid workers to Australia. I am unable to transmit Ebola unless I become symptomatic, and as public health professionals, we need to educate people on this point so that returning health workers are not made to feel a threat to public health. It takes at least 3 days of being ill to become contagious to others. The focus here should be to help people to understand Ebola and help contain the disease. Our role is not to respond to hysteria. Our role is to educate everyone so that we are able to maintain a public health role that is calm and rational. All those who guide public health policy, such as politicians and members of health departments, should read the Presidential Commission report for guidance on how to handle the next Ebola outbreak. The world needs to learn from this outbreak. While the initial response was slow, and we can concentrate on the negative aspects of that response, there is a positive message. The world recognized that a very nasty disease was probably going to take millions of lives, and some communities did respond, and the response was successful. Red Cross, with its values and commitment to humanity, was a significant part of that response. We showed without the resources available in our Australian hospitals, we could build a simple hospital and supply simple rehydration and save so many lives. We could persuade people to enter our hospitals to isolate themselves so others could live. We tried to relieve suffering among the dying, and we provided some dignity to safe disposal of dangerously contaminated bodies. Red Cross showed that the combination of knowledge, humanity, and courage, and the rejection of pure self-interest could make a difference. I believe the founder of Red Cross would be proud of what the organization achieved. That's the talk.